October is Domestic Violence Awareness Month, and it seeks to charge everyone to do better and support those facing this very serious problem. Domestic violence affects millions of women and men of every race, religion, culture, and status. Advocates say nations must take strategic action to curb this menace and end the negative effect, especially on the health and psychology of victims. Well, joining us via Skype from Connecticut is Dr. Sandra Ike-Anyoha, founder, National Association of Nigerian Nurses in North America. Thank you for joining us on TVC Midday News.
Thank you for the opportunity to be here today.
You're welcome. Now, if we are looking at curbing the menace of domestic violence, where do we begin?
First of all, I'd like to congratulate all Nigerians on the successful demonstration of EndSARS. We know that violence of any kind has devastating health consequences. So to answer your question, I think where we begin is prevention. We have to identify preventive strategies. I think every society needs to put together a robust prevention and intervention strategies to be able to decrease domestic violence.
And when we talk about prevention and intervention strategies, for prevention, what are we looking at?
So I can tell you that nurses, as part of our code of ethics and also in their curriculum, has been taught to do domestic violence screening at every point in entrance in any healthcare facility. So when you talk about preventive strategies, which we know in public health, prevention decreases mortality. So creating awareness, education opportunities for nurses to be able to do DV screening accurately help mitigate and minimize those risk factors that they identify during the screening. Nurses are natural leaders among healthcare professionals to address domestic violence. As a matter of fact, nursing organizations were the first to implement domestic screening tools in healthcare facilities. We know domestic violence is the leading cause of maternal health and fetal deaths. We also know that domestic violence, affects everybody, children, men and women, and the most victims who are involved are our children. And, I'm just very impressed with what happened in Nigeria in the past few days. So it shows that as a society, when we put our minds together, public and private sector, and engage everybody in the community, we can decrease violence of any type.
Now, when we talk about intervention, I wonder which direction that is going to take, because some persons will say that there is the issue of religion and perhaps tribal biases when it comes to domestic violence.
So one of the strategies is engaging community leaders. I know for NANA, which, domestic violence was actually the founding factor for the National Association of Nigerian Nurses in North America. You had the opportunity to speak to our executive director earlier, who kind of showed the statistics of what DV has globally. And so with prevention, we kind of engaged, community leaders, whether it's in the mosque or churches, considering that Nigeria has a lot of cultural implications which can affect domestic violence. And we do acknowledge that, but we also acknowledge that, violence, regardless of your, ethnicity or religion, is, it's something that needs to be prevented because it has devastating health consequences, most significantly among our children. Children who grew up in homes that have violence experience lifelong health consequences. And what we don't want is to bring up children in a society where they are not productive, because it does affect their mental health. So a big portion of prevention is geared towards creating awareness, engaging community leaders, educating our healthcare professionals to be able to support families in identifying those risk factors and kind of giving them the right resources. There are known research risk factors that can lead to domestic violence, whether you have, alcohol, drug abuse involved, or, say within a marriage where they can refer to marriage counseling, whether it's through their pastors or, whatever their cultural or
All right,
religious belief.
because of the want of time, I'd like for you to quickly comment on the issue of breaking the silence, the culture of silence, rather. It is said that it is very important for a lot of persons going through issues like this to speak up. Talk to us about this.
There's a saying that silence is a killer. We see that even with diabetes, which is a big health issue. And there are people who are still afraid to tell people they're diabetic. Domestic violence is also like high blood pressure, which is a silent killer. It's important for victims to seek help, whether it's a man or a woman. They need to speak up, and hence the October Awareness Month is a way to continue to draw attention to this problem, because it's important for people to speak up and for family members to step in and help those in that situation seek resources.
All right, Dr. Sandra Ike-Anyor, founder, National Association of Nigerian Nurses in North America. Thank you for your time on the Midday News.
Oh, it's a pleasure. Thank you for having me.